Assalamualaikum. My name is Rabiatul Umairah and I will present the introduction of our project Mediq. First, human-computer interaction or HCI is about how people use technology. It focuses on making technology easy, safe, comfortable and suitable for users. In healthcare, HCI is very important because it helps create systems that are clear, simple and easy for patients to use. However, there is still a problem in Malaysian public hospitals, especially in the waiting and queue system. Patients often need to wait for a long time, sometimes more than 2 hours, even for a short consultation. During the waiting time, they usually do not know their queue status because there are no real-time updates or estimated waiting times. Besides that, queue numbers are often announced using speakers in crowded and noisy waiting halls. This can be difficult for elderly patients, especially those with hearing problems or poor eyesight. Some patients may miss their turn, feel confused, or become worried if they leave the waiting area for a short time. To solve the problem, our team proposed Mediq, which is a mobile healthcare application. Mediq helps patients check their queue number, manage appointments, monitor medication, make online payments, and use accessibility support features. With this application, we hope to make the hospital waiting experience easier, more convenient, and less stressful for patients. Thank you.
Next, this slide explains the proposed healthcare system that we have designed. The system acts and integrate healthcare platform, which is user can manage different healthcare service in one place, including appointment booking, medication access, and medical record management. Next, the system includes an efficient queue management feature. By using the QR code and real-time queue tracking, every user can monitor their queue status and reduce waiting time at healthcare facilities. So that the system is also designed with a user-centric interface. The dashboard is simple and easy to navigate, allowing user to switch it between the different services without confusion. This may help improve the overall user experience. Next, the system follow a streamlined user flow. User only need to go through a few simple steps. Start with login, selecting a service using the required features and completing their tasks, so that this can make the system more efficient, convenient and user-friendly.
Good day everyone, my name is Umairah. Today I will be explaining the HCI features in Mediq. Mediq is designed with a strong focus on usability and accessibility, especially for elderly users, patients and individuals who may not be very familiar with technology. The first key feature is large buttons, which make the interface easier to see and press. This helps reduce mistakes and makes the application more comfortable to use. Next, Mediq includes a voice assistant that provides audio guidance. This feature is very useful for users who have reading difficulties or visual impairment. In addition, clear and simple icons are used so users can quickly recognize each function without confusion. The application also uses a simple navigation menu, allowing users to easily access home appointment, QR scanning, updates, and profile settings. The touch interface is designed to be smooth, responsive, and user-friendly. Finally, Mediq offers several accessibility options such as large text mode, large button mode, high contrast mode, and voice assistant. In conclusion, Mediq focuses on simplicity, inclusivity, and ease of use to provide a better overall user experience. Thank you.
And good morning to everyone. My name is Nazila Rana Muhammad Rozi from IFOM B. Today I will be presenting our prototype for Mediq Smart Hospital Company Zone. So for our prototype, I use Figma to create the prototype. So here we have the main page, the login page, where it serves as the main entry, where the first thing user need to do is to log in to the app by IC number and full name, and then just click the login button. When user click the login button, they are taken to the home page. So for the home page, it serves as the main entry point where user can access the system key function. For example, these three main menus we have here: appointment, my medication and visit history. And also here we have the health and activity articles. It's just like a promotion for a more healthy lifestyle. Also, user can navigate through the system using the navigation bar. Here we have 5 navigation bar. The first one, home, appointment, QR scan, update, and for fun. So each button is clearly available to help user move between pages efficiently. For the menus first, here when the user click appointment, it will take them to the appointment pages. And then when user click the my medication, it will take them to the medication page. And when user click the visit history, it will take them to the visit and medication history page. For appointment navigation bar, it will take them to the appointment page. On this page, user can see their appointment details such as date, time, and the doctor's name, and also the status of their appointment. And clinic name also are here for user to refer. And then we have QR scan page. Here, QR code and queue number, where user can see their queue number and also track their queue number. User just need to click the track queue button, and then it will lead to the real-time queue tracking. Here we can see the now serving is number 121, and the user number is 128. Also, here we have the estimate waiting time, so user can see the waiting time. And here we have the return button. The user can click here, and then it will lead to the home page. The next one we have update. Here we have the medication, so user can see their medication history and also view details. Here we have the medication history. User can click here, view details, and it will go to the visit and medication history. Here user can see their appointment date, doctor name, medication collected, and application date. Next we have profile. Here user can see their profile and also help center. User can see the name, IC number, phone number, and address. And then here we have the accessibility setting button. When user click the accessibility button, it will lead to the accessibility setting. Here we have 4 settings such as large text mode, high contrast mode, voice assistant, and large button. So user can edit their preferred setting and then click the save setting, and then it will go to the profile page again. And then also here we have the payment button. Here the payment button, user can see the outside balance. And also we got 3 payment methods such as touch and go, Wait Now, online banking, and debit card. Here we have the Pay Now button. User can click the button Pay Now, and then user can see their payment successful pages and the amount of payments that they have made. Also, when user click the Finish button, it will lead to the payment page again. The next one is View History button. User can see their payment history here and also the balance after making a payment and the history payment. We have the notification button. Here, user just need to click the notification, and then we show every reminder for the user, such as appointment for the upcoming appointment and medication start and queue number. The last one is user can log out from their profile just by simply hit the log out button on the profile pages. So everything is designed to be straightforward and user friendly with clear labels and instructions. So in summary, this prototype provides a simple and intuitive navigation flow so user can zoom between pages and complete their tasks efficiently. That's all. Thank you.
Next, let's talk about the usability consideration of Mediq. Our application is designed to be smooth and user-friendly. It focuses on 5 key principles. First is ease of use. The app has a simple interface. It features clear labels, large buttons, and an organized layout. This helps elderly patients and first-time users use the system easily. Second is clear navigation. The menu structure is consistent. User can move between sections quickly. They can also return to the home page anytime using the home icon. This reduces confusion and saves time. So the third is accessibility. Mediq is built for everyone. It includes large text, a high contrast mode, and voice assistant. These features support elderly users and individuals with visual impairment. Fourth is visibility and feedback. We keep our users informed. The app sends the confirmation message and real-time queue updates. It also sends appointment reminders and medication notification. This removes uncertainty for the patients. Finally, we focus on user satisfaction. Features like digital check-in and queue tracking reduce waiting times. This makes healthcare service much more convenient and efficient. In conclusion, Mediq improves accessibility and boosts efficiency. It provides a better healthcare experience for everyone.
To wrap this up, the Mediq application successfully demonstrates how HCI principle can be directly applied to a healthcare environment. Our system delivers a highly user-friendly and efficient experience for patients. This interface design highlights the massive importance of key usability principle, which is specifically ease of use, clear navigation, accessibility, visibility, and user satisfaction. By focusing on this design core value, Mediq is able to successfully manage and reduce unnecessary waiting time for patients, and simplify otherwise stressful healthcare-related process so patients don't have to face communication barrier. That is all for our presentation. Thank you for listening.